Welcome to Hope Natural Health, the podcast inspiring you to be your best version. Join me, your host, Dr. Erin, naturopathic doctor, dog mom, cancer survivor, and girl boss weekly as we discuss all things health, hormones, and happiness with a little side of this thing called life. Welcome back to the Hope Natural Health podcast, where I try to get you healthy the right way. Last week, we talked all about endocrine disruptors, and today we're going to talk about food sensitivities. Now, food sensitivities, allergies, intolerances, they could be often confused and used interchangeably. So whenever I have a patient that says, I have a food allergy, I said, do you have an allergy or do you have a sensitivity or are you intolerant to that food? So a food allergy actually causes an immune system response that can affect many different organs in our body. And it's called a type 1 hypersensitivity reaction, where you eat the food, your immune system identifies a component of the food, and it produces IgE antibodies, E as in Erin, against the food. And this usually happens within an hour of you eating this food. So it's a very quick response if you have an allergic reaction to a food. However, the IgE response can be anywhere from mild to severe, where you need the EpiPen or the anaphylactic response to this food. Then we can also have what's known as food sensitivities, which are non-IgE responses, and these are called type 2, 3, or 4 hypersensitivities. So we actually can still form an immune response, but it's a delayed response. So that's where food sensitivities are hard to pinpoint or toggle, because it could have been a food that you ate 3 or 4 or 5 days ago, and you're just now reacting or having some sort of response to the food today. Now, the testing that I do, we test the IgG and the IgA responses to foods. Now, these are different immunoglobulins also found in our bodies, but the IgG response is more like downstream to intestinal permeability, whereas IgA response, if you have an intolerant or a high response to the IgA component of the food, you're actually damaging the intestinal mucosal lining of your gut, which is not a good thing. So, for instance, I have just a handful of patients that have an IgA response to foods, and that's actually really, really important to point out, because it's damaging their intestinal lining, whereas many people have multiple IgG responses, which is most common, but this is also the delayed response. A lot of these foods too come back and they're like, I don't eat them. And I'm like, well, that's good, because you're actually still responding to them. Or they're foods that they eat to every single day and they had no idea that they're eliciting an immune response to this food. We also have the food intolerances that don't actually involve the immune system. So these can be a reaction if we have a deficiency in a protein or an enzyme that is needed for the proper digestion of the food. So like lactose intolerance is a good example of that, where people lack the enzyme lactase and they can't break down the carbohydrate, so they have an intolerance to dairy and that category of food. So intolerances, sensitivities, allergies. So I do testing for sensitivities and allergens, and it's super important to know if we have, more importantly, food sensitivities, because there's so many different symptoms that can happen if you have food sensitivities. It could be anything from digestive They could be anything from digestive symptoms such as gas, bloating, abdominal pain, diarrhea, constipation, or you can have, symptoms of like feeling ill, like maybe fever, fatigue, headaches, brain fog, or they can manifest on the skin, such as rashes like eczema, dermatitis, skin itchiness, redness, even like joint pain, muscle stiffness, swelling. Like these can be all signs of food sensitivities. So if you're listening and you're like, I don't know what's wrong with me, but I have all of these symptoms, I highly recommend you do some sort of food sensitivity testing to see if you're reacting to foods that you're eating on a regular basis. A lot of people think, well, I have a healthy gut and I have normal bowel movements. I don't have anything wrong or any food sensitivities. I highly suspect you probably do if you're exhibiting any of those other symptoms, because it doesn't necessarily need to manifest in your bowels. Like I said, you could have headaches, you could have rashes, brain fog, fatigue. A lot of those things come, along with hormone imbalances too, which I talk about regularly as well. So food sensitivity testing is something that I do with a lot of my patients to see if they have some sort of reaction to foods that are contributing to a lot of their symptoms and not making them feel well. Now, if you already know that you have a lot of food sensitivities or have a lot, or perhaps you're having a lot of digestive complaints, it's not something that I usually do right off the bat, because it's considered if you have 10 or more food sensitivities, which the testing I do test or will give you results if you're mild, moderate, or a high sensitivity to the food. And if you have 10 or more, that's what's known as leaky gut. And I know I've talked about leaky gut on here, but that's increased intestinal permeability, where now your junctions in your gut are loose and we now have reduced nutrient absorption. And that's where all of these symptoms can happen. The various, broad sensitivity symptoms like the brain fog, headaches, rashes, or even the bowels. So if that's the case, then we'll work on repairing the gut first and building back those tight junctions so that we don't have a reaction to the foods. Because if we do the food testing too early, you might react to every food on the planet and then you don't know what to eat. And that becomes more of a struggle than doing the testing in the beginning and limiting your foods and eating very, very, very selective foods. The good thing is with food sensitivities is we only need to avoid the foods for maybe 3 months, upwards of 3 months, and then we can add the foods in one by one and see how you react. So you add a food in, you wait about 7 to 10 days, see if you have any sort of reaction, and then you can add another food in. A lot of people know, well, that food I'm not ready for. I feel worse when I eat it, so they'll take it out. Meanwhile, if you're working with a physician, they're rebuilding your gut and doing gut repair so that way you can heal the gut so your food or your body can handle the foods again. So food sensitivity testing is something that you might want to consider doing in the new year. You can buy over-the-counter testing from websites. Everlywell is a very popular one, and I have a lot of patients do that one. I have no affiliation with them. They only do the IgG testing. They do not test the IgG and the IgA. My testing I do through Vibrant Wellness. They do the IgG and IgA testing. We also have the IgE testing for food allergens as well. The common test I do test for 96 foods. However, there's additional testing for food additives. There's a vegetarian only panel that doesn't include any meats or seafoods. And then there's another panel that does, I think, 80 something foods, which is more obscure foods, but still very helpful. So if this is something that you want to do, I highly recommend you ask your physician for it. Or if you're a patient of mine or live in the Phoenix area, you can always contact me, and I'd be more than happy to determine if you have any sort of sensitivities, allergens, or even intolerances to food. I hope you enjoyed this podcast. We'll see you again next week.